The purpose of this presentation is to discuss the application Epocrates. Epocrates is a free application for Apple and Android, which is suitable for a smartphone, PDA, or tablet. The purpose of Epocrates is to provide a helpful reference for healthcare professionals. There is a tab for drugs, which includes a lot of helpful safety and prescribing information for thousands of brand, generic, and over-the-counter medications. Examples of provided drug information include adult and pediatric dosing for FDA-approved and off-label indications, black box warnings, adverse reactions, pregnancy risk categories, pharmacology, and the approximate retail price of the drug. Another tab is for checking drug interactions. A list of up to 30 drugs can be checked for potentially dangerous drug-to-drug interactions. This can be helpful for nurses to check the patient's long list of medications for interactions and is also helpful for prescribing physicians to check about possible drug interactions before prescribing the medication to the patient. There is a tab called Pill ID, which is useful when figuring out the identity of a pill based on its imprints and characteristics. Under the tab Guidelines, there is a growing library of 40-plus evidence-based recommendations for patients with certain conditions. For example, there are guidelines for how to manage hyperglycemia in diabetic patients. There is also a tab for calculators, which has a list of helpful calculating tools. Examples of calculators include body mass index, drug dosing, mean arterial pressure, and Parkland formula. There is a tab for tables, which contains helpful quick reference clinical tables that provide guidelines and drug information. An example of a table is one laying out the APGAR score. Another example is a table for adult normal lab values. Under the Formulary tab, there is information on pharmaceutical patient assistance programs. This is helpful for when nurses help patients plan how to afford their medication prescriptions. Another tab contains Athena Text, which provides a convenient way for healthcare providers and treatment teams to communicate over secure text messages. There is an extensive network of U.S. physicians that can easily be contacted for referrals and consults. The Contact Manufacturer tab provides a list of medications along with their manufacturing company and contact information. This is helpful when questioning medical information regarding a certain medication. For $174.99 a year, Epocrates Plus provides access to a longer list of resources for healthcare professionals. There is a reference for ICD-10, ICD-9, and CPT codes that can be searched by category, diagnosis, or by using partial codes. The Disease tab provides in-depth peer review content developed in collaboration with the publishers of the British Medical Journal. Information included is risk factors, diagnostic tests, differential diagnosis with links to associated disease topics, treatment options, and follow-up instructions. Also, there is a tab for alternative medications, which provides information on herbals and supplements. Examples of the information include reported uses and doses, cautions, adverse reactions, and drug interactions. There is a tab for labs, which shows information on hundreds of labs and panels. Also, Epocrates can be found embedded in the electronic health record by Athena Health. The application is easy to use. The layout is simple and professional. The workflow is easy to navigate. There are fast result times. Information is easy for healthcare professionals to read and understand. Epocrates states that it is to be used as a reference and not as a substitute for personal clinical judgment. Overall, Epocrates can be beneficial as a medical reference. It is free and easy to use. The downside to the application is that not all features are included in the free application. The presenter would recommend this application to healthcare professionals since it is a great reference tool for drug information and interactions. This application is also beneficial to nurses when clarifying doctors' orders. The utility and usability of this application makes Epocrates beneficial to nurses. The application is also very helpful to healthcare providers.